decided to choose the City of Melbourne as an agency in this assignment. But first, where is actually the City of Melbourne? The City of Melbourne located on 120 Swanton Street, Melbourne, Victoria. So have a look at the map, and a little bit closer, you can see the City of Melbourne Council located in the heart of the city. This is the local government authority for the central Melbourne and the surrounding suburbs. As we can see, the City of Melbourne covers the area of 37.7 square kilometres. According to Australia Bureau of Statistics 2008, estimated resident population normally higher than the census count at the national level because it's referred to all people regardless of nationality or citizenship who usually live in Australia. Therefore, as 30 June 2019, estimated resident population of cities of Melbourne is around 178,955. But by 2041, this population is expected to reach over 384,000. The majority of the population are aged from 15 to 39. There are 56% of the population is born overseas, and the main overseas country of birth is China. In this presentation, I will going to explore the services provided by the City of Melbourne and how they are related to public health. Let's have a quick look at the City of Melbourne. The City of Melbourne provides all kinds of information about people in the city, housing, government, the economy, safety, health, education, well-being, food security, production, transportation, cultural diversity, and the environment. Before touching on the aims and objectives of the City of Melbourne, I would like to define public health as the resources or infrastructure that allow people in the community to improve their health and well-being. And everybody should have the opportunity to live their life to the fullest. According to the Council Plan 2017-21, their aims to develop and achieve the community's vision of Melbourne as a bold, inspirational and sustainable city. According to the annual plan, their goals for each aspect of the city is below. The target population is the people who live in Melbourne CBD and the surrounding suburb, from young people, elder, family with children, multicultural community, to tertiary students, including international students. They plan and provide services, facility, and infrastructure for the local community, strategically plan and regulate land use in the municipality, make and enforce local laws, and discharge duties. Those services ranging from arts, cultural program, tourism, housing, urban planning, capital work, maintenance, and waste management. They also have programs prioritized mostly about environment and health, as climate change mitigation strategy to 2050, Green Our City Strategy Plan. So let's move to funding arrangement. The City of Melbourne would deliver $435 million worth of program and initiatives in the 2018-19 financial year, with the majority focused on innovating the city. Most of that they invest in infrastructure and services as road, building, parks, drains, up to 90% of the total assets. $105 million in renewal, upgrades, and expansion. $20 million in maintenance works. Besides, there are investments for events every year such as Moomba, Melbourne Music Week, Melbourne Knowledge Week. Noticeably, $1.8 million was spent on supporting homelessness including nighttime safe space, daily support team, youth homelessness support, and grants. So now let's consider the city of Melbourne affordability, accessibility, and availability. The city of Melbourne contains all of the options of services, including the charging fee program and non-charging fee program. In regarding of sport, they have suggested taking part in the local health or the recreation center, where they also post some free videos about home workout. They provide information about many kinds of sports that people can access freely in the park, and also information about the sport grounds you and permits, which could cost a certain amount of money. They make it clear all the rules and prices so that people could consider the best for them. So I would say that this is flexibly affordable for everyone. The city of Melbourne can be easily accessed because it's located on Swanton Street, but close to many transportation as tram and train. You can also access online for services 24/7 on their website. They are also active in all the social media platforms as Instagram, Twitter, LinkedIn, and YouTube. Most of their physical services are in Melbourne CBD, which is library, multicultural hub, and gallery. The library is also free to access for everyone. It's equipped with good facilities, a reading section for children, working, study, and computer area, which means everyone could be able to afford the knowledge. Besides, there are many multicultural services, such as translation service, refugee welcome zone, multicultural hub, multicultural communities, and services for international students. Moreover, art outdoors projects are presented in many places in the city with public art, busking, and street entertainment. They also have arts grants program, which is accessible for everyone of all background and abilities. The applicants can be supported to submit an application, and there is also available funding to improve access requirements when deliver the projects. There are all kinds of activities available and created by the City of Melbourne. So what is the City of Melbourne related to public health? The City of Melbourne are highly aware of their role in public health. They have been implementing the municipal public health and well-being plan with 5 key priorities: active living, healthier living, preventing crime, violence and injury, planning for people, social inclusion. The City of Melbourne promotes healthcare, but the services and information about childcare, education, health support, safety and emergency management, LGBTIQ communities, and homelessness. Specifically, resources ranging from food policy, food safety to drugs, smoking, COVID-19, all found in the website provide highly detailed arms to prevent and protect people from unexpected accidents. This can prove that resources and infrastructure from the City of Melbourne allow and enable people in the community to improve their health and well-being. With the social inclusion priority key, there is no restriction of age, gender, and background. In the concept of City of Melbourne, this can be seen through the ideas of being affordable and accessible to the community in order to reduce the differences in the health status among people. They are taking care of many plans of Aboriginal community, as Aboriginal Melbourne Action Plan, Year-Round Boy Festival 2019. They also have programs for disabilities, elder people, and risk young people, as well as Refugee Week, Cultural Diversity Week. One of the examples is the ongoing homelessness funding and support. The City of Melbourne funded $1.2 million for the projects collaborating with CoHealth, the Street Doctor Project. City of Melbourne has positively impact on the behavioral lifestyle. There were more on-camp activities that people could come and improve the quality of their lives, such as sports center and library. Therefore, they improved the social community. On a diagram by Dale Grant, 1991, sport plays a part in healthcare services as its promote healthy lifestyle, which influence the social and community networks, to individual lifestyle factors, to age, sex, quantitative factors. Another way of City of Melbourne to address primary healthcare is through health education. The City of Melbourne has the Melbourne Youth Services, which deliver many educational programs for young people in the community, such as Aboriginal and Torres Strait Islander young people, culturally and linguistically diverse young people who identify themselves as LGBTIQ community, international students, young people at risk or experience homelessness. I think this is a very ethical and helpful service because their target is young people who age from 12 to 25 from all different backgrounds. And they focus on helping these young people to improve their health as well as mental health, giving them opportunities to be exposed to activities that are necessary for their life, such as cooking with good nutrition, life skills, how to stay safe. I think the City of Melbourne covers most of the important services, but the thing is, I believe that there are still the number of people who could not access all the information as they rely on the internet. Those people such as elderly who doesn't know how to use the media to reach for help. So what I suggest is they can do more campaign about raising awareness of people and helping vulnerable groups and people who are unable to reach for those services. In the conclusion, I would highly recommend City of Melbourne for everyone because they have met all the criteria of a strong supportive organization. City of Melbourne have done a good job in delivering the opportunities that is necessary for people's life in general. I hope everyone could find this organization is helpful for themselves, understand their own value and receive the right support.